Hi, it's Michelle, and I wanted to talk to you real quick about something that I was talking about earlier today, and I thought it was really good, and I think it will be beneficial. So, I want to talk about the way that we share our symptoms with our doctors, because the truth is that we are so used to being in defensive mode that we just want to be believed. So, when they ask us certain specific questions, we actually get offended and we say, it happens all the time, and that's not necessarily the truth. They're trying to get at very precise, specific questions about comorbidities, and if those comorbidities are left in place, they actually can cause a failed decompression. So it's not that they're trying to not believe you. It's that they're trying to narrow the field and see if they can treat you in a way that even if you do end up needing a decompression, that it might make it more successful. And so, some of those things that I wanted to talk about have to do with high and low pressure. So, when you have high pressure, you tend to have a headache that is worse when you're laying down. You might wake up a few hours after you've gone to sleep at night and or first thing in the morning with a really bad headache. And this isn't just back at the occiput at the back of our necks, like if we sleep wrong on a pillow, especially with Chiari, right? With Chiari, you can have just a pillow just off an inch, and your neck's going to be wrecked for 2 weeks. But this is really at the top of the head. You're going to feel pressure from the top of the head. It's going to feel, and in the back of the eyes, it's going to feel more like if you have sleep apnea and you sleep without your CPAP on, right? You just feel a lot of pressure in your head, and those things are connected, actually, by the way, but not sleep apnea. Sleep apnea is definitely connected to our conditions, but that's not what I'm talking about. There's a reason why the headaches feel the same. But so you'll wake up in the morning with a really bad headache, and I'm sitting here looking at my bed going, oh man, I remember these headaches. And but you'll wake up with a really bad headache, and you'll decide to press through that headache, and you'll get up from bed, and you'll be in a lot of pain at first, but as time progresses, as you've been upright for a little while, the pain starts to dissipate, and you can go on with your day until you have to lay down again. And you don't get a lot of sleep when you have high pressure headaches just because of the pain. Low pressure headaches are the exact opposite. They're known for being worse when you're upright, and they are relieved by laying down. But here's the thing, we think our doctors are just going to tell us to sleep more. And, most of us are insomniacs until we get chronic fatigue syndrome. But most of us are insomniacs, so we don't sleep a hell of a lot. And we're afraid that they're going to blame it on all these other things. So we just say, it hurts all the time, right? And we're hurting ourselves when we do that, right? I mean, really, we could be hurting the rest of our lives, because if this high pressure remains in place and the only bone that is holding our skull, our brain inside of our skull, is removed even a little bit, that high pressure is still there, and it's untreated, and it will push everything down. The pushing that was already going on will push everything down, and you'll have a bigger hole for your brain to fall into. And likewise, if you have a leak that's causing low pressure and that's not dealt with before decompression, then they'll open that hole, and it'll be an even bigger hole for that leak to just kind of pull your brain downward. And so you end up with brain slump. You end up with, I don't even care what they call it. It doesn't really matter, because it doesn't matter. We just want to be fixed. But it's important that we get those headaches right, and we are not afraid to open up about the distinct differences in our headaches. And I know that when I first talked about my Chiari, when I was first diagnosed, I explained it that whenever the back of my neck started to hurt within 10 minutes, I had a sinus headache. And my neurosurgeon was like, there's no connection between your sinuses and the Chiari, I promise you. And I'm like, no, I promise you. I have a year of notes. I've been journaling, right? I promise you there is a distinct connection. When the back of my neck hurts within 10 minutes, I will get a sinus headache. Or when I get a sinus headache within 10 minutes, the back of my neck will hurt. We kind of argued a little bit, but the truth is that I didn't know anatomy enough to know that it wasn't my sinuses, it was my optical nerves, and that was a sign of high pressure. Vision problems, another sign of high pressure. But not everybody, I shared this in one of the other videos, not everybody with high pressure gets papilledema right away, right? But how much is it in error for a doctor to say, well, we're going to wait. No, we know your pressure is high, but we're going to wait until you start to go blind and it causes irreversible nerve damage to your eyes. And then we will try and treat you. I mean, that's just absolutely absurd to me. But high or low pressure, they also have another symptom, and that is its effect on the pituitary gland. So the pituitary gland, it looks like this punching bag. It's like a tear shape, and it drops into this crevice inside your skull called the sella turcica. And when you have high pressure, the fluid, the cerebrospinal fluid, gets pushed down into this crevice, and it flattens your pituitary gland on the bottom. And it's the crevice is actually called the sella turcica. And so when it has more than 50% cerebrospinal fluid in it, it's considered empty sella syndrome. And you can look it up. Sella, S-E-L-L-A. So empty sella syndrome. And, some doctors are actually saying, well, you don't have enough cerebrospinal fluid in there to be empty sella syndrome. And they're absolutely right. But if they actually look up, there's so much more research on something called partially empty sella, where they actually do recognize that even lesser amounts of cerebrospinal fluid, the pressure that it puts on the pituitary does cause endocrine problems. And so that should be a really good indicator that's visualized on the MRIs for doctors to look at. And the reverse of it is when you have low pressure and it goes untreated, it will eventually affect your pituitary as well, and it will enlarge your pituitary inside this sella turcica, inside this crevice, and you will end up having endocrine problems. So what do endocrine problems look like? Well, a lot of times your pituitary actually sends signals to your thyroid, right? And it tells your thyroid to produce certain hormones. And so what happens is a lot of times you can have hypothyroidism, you can have hyperthyroidism, and you can have hypopituitaryism where it hasn't yet affected your thyroid, or hyperpituitaryism where it hasn't yet affected the thyroid. So just because you've had a clear thyroid test, most of the times when doctors check our hormones, they don't check our pituitary, they just check the thyroid, right? And they check for these certain chemical reactions that the thyroid gives out that stimulates hormones. So and these are just things. I'm not a professional. I'm not a medical professional. I'm not pretending to be. What I am trying to do is just kind of share things that I found and things that I think that could really benefit the Chiari community, because I really do believe that we can make a difference in each other's lives if we step out and try, and if we stop trying to attack each other and start trying to lift each other up and help each other understand the things that we find. So know these signs, no matter how absurd they sound. Talk to your doctor about them. When I started having hormone issues, I didn't really know what it was. I noticed that I was losing hair, not just hair on my head either. I have like a half of a dime size spot of underarm hair that grows at all. The rest of my pits are pretty much bald, and so is the rest of me. I don't really have to shave my legs. I'm actually starting to now have to shave my legs, and that honestly, I can actually see that on my MRIs. When I was looking at my MRIs from 2010, when I was diagnosed with Chiari malformation, I actually did have empty cell syndrome, and I was probably about 70%. My cell turcica was actually about 70% full of cerebrospinal fluid. So I had high pressure for a while, and it causes empty cell syndrome. And when you compare it to now that I have low pressure, and there's no cerebrospinal fluid in there, you can actually see where because the cerebrospinal fluid, it's not just free flowing in there, it's inside the dura. So there's a protected covering. And I think that as my pituitary started to expand a little inside the sella turcica, that it just popped back out, because you can compare the pictures, and I had empty sella and now I don't. And now I am starting to get hair growth where I have to shave my legs and whatnot again. And yeah, that kind of sucks. But it is kind of scary when you start not having hair all over. So we just have to stay on top of it, no matter how minuscule it is. Doctors, pay attention to these things, because the truth is, we shouldn't have to. When something's wrong with our brains control everything, right? They really do. They control everything. The heart does not beat without that brainstem. Right? We don't breathe, we don't gag, nothing works when our brain isn't working right. And so we really need you to know the symptoms, excuse me, and know common relations. Like, for the fact, I asked my OBGYN to put in a Mirena to control my menstrual cycle when I had to have I've had 8 surgeries, and I had them in 5 years, and 3 of them I ended up starting my menstrual cycle while like the day of my surgery, which is really annoying. So I asked him to put in a Mirena to help me not have a cycle. And the truth is, the Mirena causes intracranial hypertension. But here's the catch, is that my OB didn't know. My OB doesn't know, it doesn't understand intracranial hypertension. So even if he read it, that's just not his field of expertise, right? And my neurologist and neurosurgeon, they're not paying attention to what I'm doing with my OB, right? So the truth is, we have to educate ourselves. We have to stay on top of it. If we're going to fight this fight, we have to fight it right, and we have to look at everything, right? We have to look at our entire systems and what we can do to make it better. It doesn't really matter if my doctor thinks that I'm fat. Am I fat? Sure, I'm fat. I'm definitely, I definitely have gained weight from when all this started, and being bedridden changes that. So we have to fight this on all levels. We have to, but it's got to start with us being open and honest about what we're really facing, and stop caring what they think of you. They are not your friends. Your surgeon is not your friend, and it doesn't matter how friendly you are with them. Okay, the truth is, they are paid professional that are paid and insured to give you a standard of care. Okay, that should be your expectation, and they don't have to like you. They don't have to, like, your personality or your smile. It don't matter. They can think your breath stinks. It don't matter, right? They need to feel free to do their job, and we have to help them do it, because the truth is, we want to get better. We need that help. We need their help, and we need to not get in their way because we're worried of what they're going to think of us. So that's all for today. Thanks.